Hi, I'm Dr. James Boone, addiction medicine doctor and internal medicine doctor, board certified, and have worked here at the Hacienda Treatment Center for the past 17 years. And I want to talk a little bit about opiates or opioids. Kind of a broad category, but something that's been heavily in the press lately as we're in the opioid crisis and the number of opioid deaths, especially with the recent COVID pandemic, and this isolation has just been catastrophic, and the numbers higher than they've ever been. So the opiates and opioids, sort of what does that mean? We use those terms pretty interchangeably, but from a pure scientific standpoint, an opiate is a pain medication that actually comes from the poppy flower. And so the classic opiate would be a medicine like heroin, but we also think of other medicines that are derived from that are prescribed, like codeine or morphine for severe pain. Those medications are opiates. And opioids actually work in the exact same part of the brain. They work on those pain fibers, but they are synthetically made. So maybe the classic opioids would be medicines like hydrocodone or oxycodone, or now the very potent opioid that's been in the news so much with fentanyl, or one of its analogues, carfentanil. But bottom line is that the opiate family or opioid family of medications, those drugs were designed for pain. And our pain fibers in our brain are in this very deep-seated part of the brain. And I'm so thankful, as a guy that's had major surgery, that we have those medications for moderate to severe pain. So they block those pain fibers, and that was their design. But these medications also work in the reward pathway. And the reward pathway is the part of our brain where all of the drugs of addiction work. And that part of the brain is to some degree, you can think of as it's built differently in people who struggle with addiction versus people that don't. And that's simplistic, but for me, my example would be as a guy who doesn't have any family history of addiction, no childhood trauma, I have an exposure to an opiate drug after my knee replacement. The only thing I have is I have some pain relief, I have some dry mouth, I have some other GI side effects. I get a bottle of 30 or 20, I take 7 tablets, helps me get through that thing, but there's nothing pleasurable that I like. People that struggle with addiction, however, they have a different experience. So I recall a young man who had severe knee injury. I gave him a prescription for hydrocodone, one of the synthetic opioids. This young man had had no history of addiction that he was aware of. He came back to the office a few days later and not trying to get more because he didn't even recognize it, but his statement was, "I feel great when I take these pills." And I asked him, he's like, "I don't know, I have more energy, I have more focus, I just feel good." This phenomenon, and if I had that, I get where then there could be the allure of that. So this opiate and opioid family of medications that have genuine sort of wonderful medical indications, unfortunately also are stimuli of this reward pathway. And so those folks that have that predilection or risk for addiction, those medications can become very dangerous drugs. Now, the scary thing to me about the opioid family of medicines is that almost like none of the other medicines that we have is that as we take those drugs, people that have that euphoric, that feel-good sense, as the dose goes higher, there is this continued increase in euphoria, diminishment of physical pain, but also emotional pain. So that person that's really struggling with job and relationship, and they're just torn up inside, it takes that feeling away. The classic triad of symptoms of people who have addiction or alcohol use of restless, irritable, discontent, this uncomfortable feeling is just taken away by that opioid. But unfortunately, right as that sort of peak happens, all of a sudden it makes me stop breathing. It puts my respiratory drive to sleep, and that's the cause of these horrific numbers of accidental opioid-related deaths. So opioid treatment, there's several different ways to go about that, and very popular, and one of the potential ways to treat opiate addiction is using a longer acting opioid. And so you'll hear a lot of people talking about the use of buprenorphine, or one of the trade names, Suboxone, or the use of methadone. And a very valid treatment option for some people who struggle with opiate use disorder. Other people that don't do well with that. And there's a pretty high dropout rate and failure rate, and a lot of people who don't want to be dependent on or have to take another medication to address their addiction. And so in that situation, what we do here of a 12-step based approach, of an abstinence-based approach, using medications to help somebody get through the detoxification process, because when you become physically addicted to opiates, getting off of them is difficult, painful, and something that typically people need help with. So for us to help that person get off of that medication, then potentially use something that actually blocks the opiate completely to help decrease their risk of relapse, a medicine called naltrexone in tablet form or injection form. Anybody who's struggling with or interested to know more about opioids, potentially you have a family member, you certainly need to know about this medication that's called naloxone, and it is a nose spray that will reverse an accidental overdose. You can go to your pharmacy and ask for that. You don't have to have a prescription. It's kept behind the window. There's no expertise. All you do is put that in somebody's nose with an opioid overdose, and you can save their life and try to get them help. I think most importantly with opiate addiction, we have this contaminated drug pool. It used to be when they thought they were buying a hydrocodone tablet or an oxycodone tablet. They knew what they were getting, but unfortunately, the drug industry, the cartels, they're now combining this very potent opiate called fentanyl. And so sometimes you think you're buying something, but it's got a little bit of this drug called fentanyl in, and you take one tablet. And in the past, you've taken 3 of those. And you take one tablet, and it's so potent that you quit breathing and literally die of an overdose. So it's an incredibly frightening world out there right now because of the contaminated drug pool with fentanyl. And I just would encourage anybody, if you're struggling with this, if you have a family member, to get them help. We would love to be a part of that. If not, we'd love to help guide you in that journey. Thanks.